The white blood cell count denotes the number of white blood cells per unit volume of whole blood. Normal WBC count ranges from 4,000 to 11,000 cells per cubic millimeter. This count varies with age. WBC count is useful to indicate infections or may be employed to follow the progress of certain diseases. White blood cells in the circulation are not white in the sense that a sheet of white paper is white, but in the sense that they are transparent and not colored. White cells are fewer in number than red cells. There are primarily two methods for counting white blood cells: the manual method and electronic cell counting. For a manual white cell count, you'll need the following materials and instruments. First, anticoagulated whole blood. Next, Turk's diluting fluid, which is composed of glacial acetic acid, 3 milliliters to hemolyze red blood cells, aqueous gentian violet, 1% weight by volume, 1 milliliter to color the nuclei of white blood cells, and distilled water up to 100 milliliters. You'll also need a WBC pipette, which is composed of a stem, a mixing chamber with a white bead inside, an aspiration tube, and a rubber sucking tube. Other essential items include a hemocytometer, also known as Neubauer's counting chamber, with a cover slip, a microscope, a lancet, and some cotton. Now, let's go through the procedure. First, obtain a drop of blood in the same manner as you would for an RBC count. Draw blood up to the mark, 0.5, using the WBC pipette. Remove any blood from the outside of the pipette with a clean gauze. Next, aspirate the diluting fluid up to the mark 11, ensuring the dilution is 1 to 20. Gently rotate the pipette horizontally with your hand to ensure proper mixing for about 3 minutes. After mixing, discard the first 4 drops of the mixture. Fill the counting chamber with the diluted blood by holding the pipette at a 45-degree angle with the slide, allowing the mixture to seep under the cover slip. Let the filled chamber stand for a minute before you start counting. Using the low-power 10 times objective on your microscope, count all the white blood cells in the 4 large corner squares and add the results together to get the total number of cells counted. When counting cells that touch the outside lines of the large square, only count those that touch the left and lower outside margins. The white blood cells will appear as black dots. Remember, the precautions are the same as for the RBC count. Calculation. Count the number of cells in the 4 large squares located at the 4 corners of the chamber. The size of the 4 large squares in which the cells are found is 1 by 1 by 1/10 by 4, which equals 4/10 of a cubic millimeter. Here, 1 millimeter is the sideline of the large square, 1/10 of a millimeter is the depth of the counting chamber between the cover slip and the ruling, and 4 is the number of large squares used to count. Therefore, the total number of cells in 1 cubic millimeter is equal to the number of cells times 10 divided by 4, considering the diluted sample. The actual total number of cells before dilution should be the number of cells times 10 divided by 4 and then multiplied by 20, which equals the number of cells times 50. Medical applications. An increased number of white blood cells indicates leukocytosis, which could be physiological or pathological, such as in the case of an infection. Physiological conditions include 1. Age. A newborn has a high white blood cell count, ranging from 9,000 to 30,000 leukocytes per cubic millimeter. This number falls to adult levels within 2 weeks. Childhood, pregnancy, and delivery also show an increased count. There is no significant change in old age compared to adult values. 2. Females during pregnancy and parturition. 3. Stress like severe exercise, severe pain, and excitation. 4. Diurnal variation. The white blood cell count may vary from hour to hour, with the highest count in the evening and the lowest count in the morning. 5. Digestive leukocytosis, which occurs after digestion. 6. Injection of adrenaline. 7. After removal of the spleen, known as splenectomy. Pathological conditions can significantly impact white blood cell counts. Acute pyogenic infections such as pneumonia, appendicitis, and tonsillitis often lead to elevated WBC counts. Leukemia, characterized by an abnormal increase in immature cells, can cause WBC counts to rise dramatically, sometimes reaching 100,000 to 300,000 per cubic millimeter. Acute hemorrhage is another condition that can affect WBC counts. Tissue damage, whether from burns, operations, or myocardial infarction, also plays a role in altering these counts. Malignant neoplasms are known to impact WBC levels as well. Lastly, metabolic disorders, including gout and diabetic acidosis, can result in changes to WBC counts. Leukopenia is a condition of decreased number of white blood cells. Leukopenia occurs when the white blood cell count falls below 4,000 per cubic millimeter. Patients with severe leukopenia should be protected from anything that interrupts skin integrity, placing them at risk for an infection that they do not have enough white blood cells to fight. For example, leukopenic patients should not have intramuscular injections, rectal temperatures, or enemas. A white blood cell count of less than 500 per cubic millimeter places the patient at risk for a fatal infection. Physiological leukopenia, rare but sometimes due to 1. Exposure to cold, 2. Aspirin, 3. The white blood cell count tends to be lower in the morning and higher in the late afternoon. Pathological leukopenia. 1. Infections such as typhoid, viral, or overwhelming bacterial infections. It is not uncommon for the elderly to fail to develop leukocytosis as a response to infection. 2. Starvation or malnutrition. 3. Viral infections like measles, chickenpox, influenza, and rubella. 4. Drugs such as antimetabolites and antimicrobials like sulfonamides and chloramphenicol. 5. Hematological disorders such as aplastic anemia, pernicious anemia, and irradiation. White blood cell counts are age-related. It is not uncommon for the elderly to fail to develop leukocytosis as a response to infection.